Imagine being born with a condition that affects every single breath you take. A condition that slowly fills your lungs with thick mucus, makes every respiratory infection more dangerous, affects digestion, and demands hours of treatment every single day. For decades, this was the daily reality for thousands of people living with cystic fibrosis. But today, something extraordinary is happening. New medical breakthroughs are changing lives in ways that were almost unimaginable just a few years ago. Yet despite this remarkable progress, there is still no definitive cure, and many important challenges remain. Stay with us until the end because we'll explore not only the latest scientific advances, but also the natural lifestyle strategies that can help support lung health, reduce complications, and improve quality of life alongside modern medical treatments. Before we continue, if you enjoy evidence-based wellness content that helps you understand your body naturally and scientifically, consider subscribing to Auralith Wellness. Every week, we explore practical ways to improve health, vitality, and longevity. Most people think of cystic fibrosis as simply a lung disease. In reality, it is far more complex. It is an inherited genetic condition caused by changes in a gene known as CFTR. This gene controls the movement of salt and water across cell membranes. When it doesn't function properly, mucus becomes unusually thick and sticky instead of remaining thin and slippery. That thick mucus blocks the airways, traps bacteria, and creates an environment where repeated infections become common. But the lungs are only part of the story. The digestive system is also heavily affected because pancreatic enzymes cannot reach the intestines efficiently. As a result, many people struggle to absorb nutrients, maintain body weight, and obtain enough vitamins from their food. Here's something that often surprises people. Cystic fibrosis doesn't affect everyone in exactly the same way. Scientists have identified more than 2,000 different mutations in the CFTR. Some produce severe disease from birth, while others cause milder symptoms that may not be diagnosed until adulthood. This explains why treatment has become increasingly personalized. Now here's where the story becomes truly remarkable. Only a decade ago, treatment focused almost entirely on managing symptoms. Doctors treated infections with antibiotics, helped patients clear mucus from their lungs, replaced digestive enzymes, and managed complications as they developed. While these treatments significantly improved survival, they couldn't correct underlying causes. Today, we see a different generation of everything I do so instinctive and passionate. Every word I move so constricted like an adjective. I got a bad credit against people who got it. New medication. I got backs over backs over tracks. This is fast, speaking slow, speaking fast. I can roast, I can gas, think I'm all man that, but I don't know what that means. A race on the past and the pettiness. A reflection of the emptiness, hilarious. You think you're worth my time, you're delirious, mysterious, because you are behind the thing exterior, inferior. You know I'll always be a bit superior. Get off of me, this ain't no humble brag. I want you to hear words, you can say them back. I want you to feel free from the chains that lasted. So believe in what you got, it was built to last. Respiratory infections are less frequent. Many patients report having The answer is simple, but extremely important. Natural approaches cannot replace medical treatment for cystic fibrosis. However, they can play a valuable supportive role by helping maintain overall health, improving physical fitness, reducing inflammation, supporting immune function, and enhancing quality of life. One of the most effective natural interventions is regular physical activity. Exercise acts almost like a natural airway cleaner. Deep breathing helps mobilize mucus, improves ventilation throughout the lungs, strengthens respiratory muscles, and enhances cardiovascular fitness. Walking, cycling, swimming, and resistance training can all contribute to better respiratory health and adapted to the individual's abilities and performed under appropriate medical guidance. And here's something many people don't realize. The healthier the muscles become, the more efficiently oxygen is used throughout the body. Better physical conditioning often translates into less fatigue during everyday activities, greater independence, and improved emotional well-being. Another critical factor is hydration. Water plays a surprisingly important role in maintaining mucus consistency. While hydration alone cannot eliminate the thick mucus caused by cystic fibrosis, drinking adequate fluids throughout the day may help support airway clearance and overall body function, particularly during exercise or hot weather. Nutrition is equally essential. People with cystic fibrosis frequently require higher calorie intake because their bodies expend more energy fighting infections and breathing. At the same time, pancreatic insufficiency often limits nutrient absorption. A nutrient-dense eating pattern, rich in quality proteins, healthy fats, colorful vegetables, fruits, nuts, seeds, and omega-3 rich fish can help support immune function, tissue repair, and overall resilience. Fat-soluble vitamins, including vitamins A, D, E, and K, are especially important because deficiencies are common in cystic fibrosis. However, supplementation should always be guided by the healthcare team through regular monitoring. Another area receiving increasing scientific attention is the gut microbiome. The digestive tract contains trillions of microorganisms that influence immunity, inflammation, and nutrient metabolism. Because many individuals with cystic fibrosis receive repeated courses of antibiotics throughout life, maintaining a balanced gut microbiome has become an active area of research. Fermented foods and carefully selected probiotics may offer benefits for some patients, although they should always complement, not replace, medical therapy.